Hi, good evening. My name is Erica Tapia. I'm going to be your nurse for today. Can you please provide me your name and date of birth?
Diego Tapia, 5'6", 1996.
Okay, thank you for consenting for this assessment. We will go ahead and begin the head, neck, and face assessment. So we're going to begin inspecting the head. As we see, there's a normal shape. We find a regular skin color along his face, regular size, regular shape. I don't feel any bumps. There's no bumps. There's no type of masses, no lesions seen in the head. There's no hair loss, so that's a good sign. There's also no signs of bleeding, no rashes on it. Can we go ahead and do some inspection of your jaw to see how your temporal mandibular joint is, or your TMJ, which will be in this side right here. Can you please open and close your mouth for me? Close, open, close. Do you feel any pain?
No.
Along your jaw? No?
No.
Okay, good. The bite seems symmetrical to me. Can you please smile for me? Can you please frown for me as well? Thank you. So he does have voluntary movements, as seen previously. All sides to me look symmetrical. Rounded shape, symmetrical. Everything so far normal. There we go ahead and keep on with the eyes, which do look round, normal white sclera. There's no drainage seen on these eyes. Along his neck, I can feel that this is symmetric. Overall, no lumps. I don't see any skin breakdown. Along the trachea, which should be in the midline area, there shouldn't be any enlargement, any noticeable enlargement of any lymph nodes or the thyroid gland. And I can definitely palpate it and don't feel any mass or lumps. Along the ears, they're pretty shiny, pink, no drainage seen in any of these. We're going to be looking for the lymph nodes, which patients shouldn't feel any pain when palpating them, because it may be a sign of infection or other illnesses as well. So as far as the lymph nodes, we have in here we have the pre-auricular lymph node, the parotid to follow, the tonsillar, which should be in this area right here. There's a submandibular, which is right around the mandible, and the submental underneath the mentor here. There's anterior cervical, which should be in this side right here. We do have a supraclavicular nodes in here. We have the occipital right in the back, and the post-auricular as well, right here, shaping the ears. And we also have underneath the posterior cervical lymph nodes. As far as the nose, I do see its septum is in place. Septum is in place. There's no deviation. Nares are pretty clear and patent. There's no drainage. The mouth, do see. Can you open your mouth for me? Can you lift your tongue? Thank you. There's no lesions. There's no sores. There's a pink members as well. Do you feel any difficulty when eating your foods, or do you feel like you cannot swallow?
No.
No? Okay, so that's another thing we also check on the patient speech. They should be able to speak clearly with no slurring or garbled words. making sure they can swallow their food. If not, you will have to initiate a bedside swallow test on the patient, for safety and aspiration precautions. As far as the thyroid gland, should be located here. We also have the anterior and posterior, and finally you will be auscultating the thyroid gland. And that is all for now, Mr. Tapia. I appreciate your agreement on this, and have a good day.